Welcome. Today we're going to talk about something that may feel new, or maybe even a little intimidating. Using artificial intelligence as a thoughtful tool in your everyday life, as a grandparent raising a grandchild. This isn't about replacing anyone in your circle of care. It's about adding one more helpful resource to it. And by the end, I think you'll see that AI can be a kind, patient companion when you need a little help understanding things. So, let's begin. If you're raising your grandchild, you're carrying more than most people realize. You're managing your grandchild's pediatrician appointments, their medications, their school health forms, sometimes their therapy or specialists. And you're doing it while taking care of your own aging body at the same time. Often without a roadmap, often without the support network that parents have. No other parent at the dinner table to compare notes with, no group of friends going through the exact same thing. And that means a lot of small questions pile up, the kind of questions where you think, I don't want to bother the nurse line for this, but I really wish I had someone to ask. That's where AI can help, not for the big things, for the small, in-between things that make life feel more manageable. Here's the way I'd like you to think about AI. Imagine you have a neighbor who reads a lot. Medical books, parenting books, all kinds of things. They're knowledgeable, they're available, and they're happy to chat over the fence whenever you have a question. You can ask your neighbor to explain something the doctor said in plainer language. You can run a worry by them before deciding whether to call the nurse line. You can ask them what a word on a school form means. But, and this matters, you would never ask your neighbor to diagnose your grandchild's rash. You would never skip the pediatrician because your neighbor said it was probably nothing. AI works exactly the same way. Helpful for understanding and preparing, never a substitute for your doctor. So, let's talk about what AI is genuinely good for. Here are 6 ways it can actually help. 1. Explaining what the doctor said in plain language after an appointment. 2. Helping you prepare a list of questions to bring to the next appointment. 3. Decoding insurance letters, IEP documents, hospital discharge papers, all the bureaucratic writing that makes our heads spin. 4. Understanding a medication or a new diagnosis in more depth. 5. Helping you sort out whether a symptom seems urgent or whether it can wait until morning. And 6. Being a patient listener at 11 at night when you're exhausted and just need to think out loud. 6 real, practical ways. We'll walk through some of them together. Now, equally important, maybe more important, here are 6 things to never use AI for. Don't use it to diagnose symptoms, not yours, not your grandchild's. Don't use it to decide whether to go to the emergency room. When in doubt, go. Or call 911. Don't use it to change or stop a medication, even if AI suggests something different from what was prescribed. Don't use it for mental health crises, for you or your grandchild. Call a professional or a crisis line. Don't share identifying information. We'll talk more about this in a few minutes. And don't use AI to overrule your doctor. When in doubt, always ask your doctor. That's the rule that holds everything else together. Let's look at one of the most useful ways to use AI. Understanding what the doctor said. Imagine you've just left the pediatrician's office, and the doctor mentioned that your granddaughter has something called reactive airway disease. You nodded. You didn't want to seem like you weren't keeping up. But now you're in the car, and you're thinking, what does that even mean? You can pull out your phone, open up an AI app, and type something like, the pediatrician said Emma has reactive airway disease. Can you explain what that means in plain language? And AI will explain it, in simple words. It might tell you it's a way of saying her airways are sensitive and can tighten up, similar to early asthma. It's manageable and very common in children. Now you understand. You can write it down. You can tell the other grandparent. You can ask better questions at the next visit. And notice, No diagnosis happened. The doctor already diagnosed. AI just translated. Here's another wonderful use. Walking into an appointment, organized. Let's say your 7-year-old granddaughter has been having stomach aches every morning before school for 2 weeks. You're worried. You've got an appointment coming up. You can type into AI, "My 7-year-old granddaughter has had stomach aches every morning before school for 2 weeks. What questions should I ask the pediatrician?" And AI will give you a thoughtful list. Questions about her diet, about sleep, about whether anything is going on at school, about the timing. Does it happen on weekends or only school days? It might suggest you keep a log of what she's eating and when the pain shows up. You bring that list to the appointment. The doctor gets better information. Your granddaughter gets better care. AI doesn't replace the doctor. It just helps you make the most of the visit. Here's a use I think will help almost every one of you. Translating bureaucratic paperwork, insurance explanation of benefits, IEP and 504 documents, hospital discharge instructions, Medicaid letters, school health forms. The kind of paperwork that makes you sigh just looking at it. You can take the confusing paragraph, type it in, or even snap a photo if your AI app supports that, and ask, "Can you explain this in plain language?" And AI will translate. It'll tell you what you actually owe, what the IEP goals really mean, what the discharge instructions are asking you to do, and when to follow up. For so many of us, this is the moment when AI stops feeling futuristic and starts feeling practical. It saves you time, it saves you frustration, and it helps you make better decisions for your grandchild. Before we close, 2 rules to remember: privacy and honesty. Rule 1. Privacy. Never type in identifying information when you talk to AI. No full names, no addresses, no social security numbers, no medical record numbers. You can describe your situation in general terms, "My 7-year-old granddaughter," without ever using her name. That keeps her information safe. Rule 2. Honesty. AI can sound very confident and still be wrong. It can give outdated information. It can occasionally make things up. Treat AI's answers as a starting point for your own thinking, never as the final word. And when AI and your doctor disagree, the doctor wins. Always. Your doctor knows your grandchild. Your doctor sees them. Your doctor is responsible for the outcome. If something AI said worries you, bring it to your next appointment as a question, not as a correction. So, where do you start? There are 3 free AI tools that work well for the kinds of questions we've talked about today: ChatGPT, Claude, and Google Gemini. Any one of them is a fine place to begin. There's no wrong choice. Pick one and try something small this week. Maybe a word from a recent appointment that you didn't quite understand, a form you've been putting off because the language is so confusing, a question you've been meaning to ask the pediatrician. Open the app, type your question the way you'd ask a friend, and see what happens. And remember, the most important thing of all, AI is a companion, not a replacement. Your doctor is still your doctor. Your pharmacist is still your pharmacist. The 911 operator is still who you call in an emergency. AI sits beside all of them. It never replaces any of them. Thank you for being here today. I hope this gives you one more helpful tool and a little more confidence as you do the meaningful, important work of raising your grandchild.